Welcome to the Lifestyle Medicine Update. I'm Dr. James Meschino. It may interest you to know that about 1 in 9 deaths is caused by heart failure, a condition where the heart muscle becomes too weak to pump blood through the system effectively. So anything you can do to prevent this condition from developing should be a priority in my mind. Now, some classic risk factors for heart failure include high blood pressure, obesity, smoking, diabetes, and lack of fitness. But in recent years, researchers have also discovered a strong link between suboptimal selenium intake and selenium blood levels and a significant increase in heart failure risk. In fact, a 2019 study showed that heart failure patients have much lower selenium blood levels than healthy individuals who do not have heart failure. But the overall evidence is much more convincing than that. Previous studies have shown improvement in heart failure by providing heart failure patients with selenium supplementation and raising their blood selenium into the ideal range. The patients improve. Now, selenium supplementation has also been shown to lower other risk factors for heart disease in these patients, lowering their LDL cholesterol, which is the bad cholesterol, and lowering the CRP, which is an inflammation marker, and also raising the good cholesterol, the HDL, and improving insulin function, which helps to improve glucose or blood sugar regulation. These were modest but important effects for these high-risk heart failure patients. In areas of the world where soil levels of selenium are quite low, like in certain parts of China, in New Zealand, in Finland, to give you some classic examples, a form of heart failure known as Keshan disease is quite prevalent, and providing citizens with selenium supplementation is shown to prevent heart failure in these locations around the world. More impressively, a large Swedish study which provided 443 healthy elderly individuals with supplements of CoQ10 200 milligrams a day and selenium 200 micrograms a day showed a more than 50% reduction in heart failure and cardiovascular disease deaths over a 10-year follow-up period compared to individuals who did not take these supplements. The researchers explained that achieving a blood level of selenium of 120 micrograms per liter was optimal for protection against heart failure. Now, many adults, without realizing it, walk around with a selenium blood level that's below 75 micrograms per liter, and you need to be at least over 100 and more ideally at 120. The researchers explained that selenium is required to protect the heart muscle against free radical damage and inflammation, two important culprits that can damage the heart muscle and weaken it. Now, CoQ10, on the other hand, helps the heart muscle generate the energy required for optimal contraction. Now, CoQ10 synthesis in the body declines with age, and thus people over the age of 45 should consider taking a supplement with coenzyme Q10 to help keep their heart muscle strong and functional as they get older. But how much selenium should we be taking? Some studies show that taking a supplement each day containing 200 micrograms of selenium helps many people reach an ideal blood level of between 100 and 145 micrograms per liter, whereas taking only 54 micrograms per day from supplements was not sufficient to achieve this outcome. I personally take a high-potency multivitamin and mineral each day that includes 200 micrograms of selenium for this reason, keeping in mind that heart failure is the most common cause of hospital admissions at medical clinics for patients older than 65 years of age. I also take a supplement with CoQ10, hawthorn, quercetin, and L-taurine, which helps maintain more optimal functioning of the heart muscle, especially important after the age of 45. But the bottom line is that many people walk around with suboptimal selenium nutritional status, which can come back to haunt you over time, manifesting in the development of chronic heart failure. Getting that extra bit of selenium from a daily supplement each day, to me, makes very good sense, at least from my point of view. So I've included the 2019 reference from the International Journal of Preventive Medicine in the text below. Thanks for watching.